Unit 7, Diseases. Lesson 1, What's AIDS? Vocabulary. Attack, attack. Syndrome, syndrome. Develop, develop. Joint pain, joint pain. Red rash, red rash. Symptoms, symptoms. Syringe, syringe. Immune, immune. Needle, needle. Sauna, sauna. Transmit, transmit. Pregnant, pregnant. Paralysis, paralysis. Appear, appear. Infection, infection. Blood, blood. Citizen, citizen. Muscle pain, muscle pain. Chills, chills. Tom is a secondary school student. He is preparing his presentation about AIDS. He doesn't know much about it, so he asks his father for help. Could I ask you a few questions, Dad? Okay. What could I do to help? What are the differences between HIV and AIDS? HIV is the virus which attacks the T cells in the immune system, and AIDS is the syndrome which appears in advanced stages of HIV infection. People who get HIV will develop AIDS. How is HIV transmitted? HIV can be transmitted in several ways. You can catch it by sexual contact with an infected person, by sharing syringes and needles with an infected person. Infected mothers can pass the virus to their babies before or during birth, and babies can get it from their mother's milk. Can we catch it by using the same towels or sharing clothes? No, certainly not. We can't catch HIV from mosquito bites, sharing public toilets, showers, swimming pools, or saunas, touching and hugging a person who has HIV. I understand more about HIV now. Thanks, Dad. What is AIDS? AIDS, acquired immune deficiency syndrome, is caused by a virus called the human immunodeficiency virus, HIV. People can have the HIV virus for many years. Sometimes they do not know they are infected, and they can infect other people. Most people who are infected with HIV will develop AIDS. Most people who are infected with HIV experience short, flu-like illness that occurs 2 to 6 weeks after infection. After this, HIV often causes no symptoms for several years. The most common symptoms are fever, sore throat, a red rash, and other symptoms can include tiredness, joint pain, muscle pain, chills, sweat, weakness, and lost weight. HIV is not passed on easily from one person to another. The virus doesn't spread through the air like cold and flu viruses. HIV lives in the blood and in some body fluids. Ways of getting HIV include sharing needles, syringes, and other injecting equipment. From mother to baby, before or during birth, or by breastfeeding, blood transfusion, sexual contact. But the virus cannot be transmitted by handshake, hugging, kissing, sneezing, touching, and sharing the same toilet, swimming pool, towels, baths, or contact with animals or insects such as mosquitoes. At present, there is no cure for AIDS. There are more and more cases of HIV infection every year, so prevention is very important. Governments are encouraging all citizens, especially teenagers, in all schools to learn more about HIV and AIDS, how virus can be transmitted, and how to avoid catching it, and how to protect themselves from getting HIV infection.